The SAL-DaunoDouble trial is a randomized treatment optimization trial trying to answer two clinically very relevant questions by using two randomization steps. It's a trial for fit, newly diagnosed AML patients. And the first question we tried to answer was whether the dose of 60 milligram per meter square Daunorubicin over 3 days is equivalent to the higher dose of 90 milligram per meter square on 3 days, or whether one of the two dosages could be or would be superior. And the second question we tried to answer in that randomized trial is whether in patients with a good response to the first induction treatment, as determined by a low blast count after first induction, whether these patients actually need a second induction treatment or whether they are fine with receiving one induction only and then proceed to post-remission treatment. And in order to answer that question, all patients which are fit for intensive treatment, irrespective of the molecular group, will be randomized between 60 to 90 milligrams in a first step. And patients with less than 5% myeloid blasts 15 days after the start of induction will go through a second randomization in which one half of patients receives a second induction with, again, 7+3, whereas the second half of patients does not or will not receive a second induction, but we will leave those patients to recover their blood counts and then check the complete remission rate, but also survival outcomes for these two groups. And at the EHA, I was able to present the results of the first randomization step, 60 versus 90 milligram Daunorubicin, not only in terms of CR rates, but also in terms of survival outcomes. And the results we saw were that there was no statistically or clinically meaningful difference, neither in response rates in terms of CRs, nor in survival outcomes, such as event-free survival, relapse-free survival, or overall survival. That means we can say, based on the results of this trial and together with the results of the English NCRI trial, that 60 milligram Daunorubicin seems to be equipotent to 90 milligrams Daunorubicin in induction chemotherapy in a 7+3 setting. And that kind of confirms or suggests that we could continue with our standard practice of using 60 milligram Daunorubicin in induction 1. For the results of the second randomization, 1 versus 2 induction cycles, we are preparing an interim analysis currently that will hopefully be ready to be presented at the next ASH meeting by the end of this year.